President Jonathan was said to have emphasized the need for everyone to work in unison to overcome Ebola, as the Minister of Health gave the status report.
2 Nigerians, 1 Liberian American are dead. 7 are alive, many of them making progress. Then in terms of surveillance, presently in Lagos, 177 persons who are both primary and secondary contacts are under surveillance. Now, with the end of the 21-day maximum incubation period, those who are primary contacts who have not developed the disease will no longer continue to be on surveillance. In Enugu, we have 21 secondary contacts, 21 secondary contacts who are on surveillance. All of them are secondary contacts because the contact they had was with a primary contact, one of those who participated in the treatment of the index case. That person is actually part of the 10 cases confirmed of Ebola virus disease in Nigeria, and that person is receiving treatment in the treatment center in Lagos. But all those contacts that are now secondary contacts in Enugu have been placed under surveillance.
On information, provision of facilities, isolation centers, surveillance in every state, and laboratory for diagnosis, he said there are provisions all over the country and dispels rumors on the spread of the virus.
In Abuja, we had 2 cases reported by 2 different hospitals. Both of them are negative for Ebola virus disease. In Anambra, the case that was thought, a corpse that was brought from one of those 3 main countries, Liberia, and people were afraid, having come from Liberia, could it be Ebola virus disease? We've evaluated all the primary contacts, all the mortuary attendants, morticians, family members. They were all tested for Ebola virus disease. They are all negative. In Abia, one of the papers carried over the weekend, we have thoroughly investigated. Clinically, what that patient has is called Steven Johnson syndrome. It's a drug reaction to an anti-malaria she took when she had malaria. But nonetheless, we've taken blood, and hopefully tomorrow or next, the result of the blood test will come up. But clinically, we're satisfied it is not Ebola virus disease. In the case of Imo, a corpse that was brought from Liberia, again, the state authorities notified us, and when we started the investigation, we found actually they had a proper medical certificate of death issued properly by the hospital. That person did not die from Ebola virus disease. So we are satisfied and okayed it for normal burial.
For the governors present, what is important is for everyone to know what to do at each point in time. They call for equipment for health workers, recommend quality control for equipment, and life insurance cover for health workers. They said that the challenge is on transparency and openness.
It's important to reinforce the necessity for transparency and openness across the whole country. This is not something you keep inside any religious house and be praying for. This is something you must report to us quickly so that in whatever place you are, we are able to respond, come and pick the patient. There are not patients also that you can move or you should move by taxis or by public transport. So it's important to understand this. If they need prayers in the isolation centers where care is provided for them, prayers can move by electronic and other means to come and move them there.
The country representative of World Health Organization commended the declaration that Ebola in Nigeria is a national emergency, while his counterpart in the Center for Disease Control said Nigeria is ahead in the effort to deal with Ebola virus. The meeting also brought to the fore the importance of keeping decent personal hygiene, as exemplified by the president and the governors present. Chukuma Onwekusi, Channels Television News.